I would like to reiterate that this session is bridging the gap, gender-informed approaches to encampments and unsheltered homelessness. There's been a change, just so that we're sure we're in the right place. So with that, I would like to take the land acknowledgements. We would like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded indigenous lands. The Kanekehaka Nation is recognized as the custodians of the lands and waters on which we gather today. Teohiake Montreal is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of indigenous and other peoples. We respect the continued connections with the past, the present, and future in our ongoing relationships with indigenous people and other peoples from coast to coast. So I would like to introduce the speakers for today. We have two speakers. We have Chelsea Kirkby. She's the VP Strategic Initiatives and Program Development at the YWCA Hamilton. And then we have Priya Shastri, Women Act. Priya will go first, so I'd like to invite Priya to come and take the first session. I would also want to shed some light about how the session is going to go. The two speakers will speak, and at the end of the presentations, we'll take questions and answers. Yeah. Thank you, Priya.
And you, Busy, have permission to tell me at 35 minutes.
I promise.
Priya, you're done.
I promise.
Hello, everyone. Thank you for joining me today to hear about the results from a study based in Toronto specific to an integrated analysis of clients of an anti-violence against women's organizations and encampment residents. A quick note to you. You'll hear me say violence against women or VAW, VAW shelter or system, and that is because traditionally that is how the system I'm from referred to itself, as the VAW or as the VAW system or VAW shelters. There's a shift occurring, and you're starting to hear the terminology of anti-violence against women sector. So you'll hear me use it interchangeably, anti-violence and VAW. Additionally, you will hear me use the terminology of generic or homeless shelter, and this tends to, under this study, refer to shelters run by municipalities or non-gender specific shelters. I also use victim and survivors interchangeably, and perpetrator, abuser, and person who uses violence interchangeably. So I just want to make a quick note on that before I go on. In terms of the background of the study, the MAP Center for Urban Solutions in Toronto brought together academics and community-based researchers to conduct research on experiences occurring during the COVID-19 pandemic in 2020. The overarching research project was called People Experiencing Marginalization and the Effect of the COVID-19 Pandemic Response, which for some reason got abbreviated and shortened into MARCO. And so under the MARCO research project, there were 5 studies conducted. And today I'm speaking to you about a joint analysis conducted between the Adapting Violence Against Women's Systems Response to COVID-19, or what people often refer to as the MARCO VAW study, and the Encampment Outreach Evaluation, which is often referred to as the MARCO Encampment study. Both studies were community-based research studies with 1 academic research lead and 1 community research lead. The MARCO VAW studies academic lead is Dr. Alexa Yakubovich, and she's currently with the Department of Community Health and Epidemiology at Dalhousie University. Her area of study is gender-based violence or intimate partner violence. And myself, Priya Shastri, I'm the Director of Programs at Women Act. At our organization, we focus on addressing gender-based violence and advancing gender equity through research, education, and advocacy. My background is in the anti-violence against women sector for the last 17 years, with 11 of those years being in management of high-risk domestic violence cases. The Encampment Studies academic lead is Dr. Lisa Boucher, who's currently with, I hope I say this right, Bruyere Health Research Institute and the Faculty of Medicine at the University of Ottawa. The community lead is Zoe Todd. She's a community scholar with the MAP Center for Urban Health Solutions at St. Michael's Hospital, and she has years and years of experience working in the homeless sector. Unfortunately, they weren't able to be here with me today, but I am happy to answer questions on behalf of everyone. So we conducted a joint analysis in terms of the background on the study. We conducted a joint analysis between the two studies. So that's to say, both these studies occurred simultaneously at the same time, but they were separate studies. And what we did after the fact was go back and take the data from both studies and then go ahead and analyze them to identify themes related to violence against women and the experiences that they had. And so the Marco study individually examined the process, experience, and outcomes of adapting VAW programming in Toronto. And the Marco Encampment study examined the experiences of encampment residents and the services that were supporting them. Both studies used a mixed methods approach, so including a quantitative survey followed by semi-structured qualitative interviews. The current analysis I'm speaking about, it relies on the qualitative data collected from the semi-structured interviews with the VAW clients and the encampment participants. And in order to participate in this study, they either identified as women, so cis women or trans women, or non-binary. The aim was to examine the structural factors that dictate who and how different participants end up in different sectors, whether there is a common set of experiences that can inform intersectoral collaboration and strengthen policy responses to gender-based violence and homelessness. The joint analysis looked at the 10 qualitative interviews conducted under the Marco VAW study and its 23 interviews conducted under the Marco Encampment study. So the table that you're looking at kind of summarizes some overarching demographic details. And so that's the combination of them. So it's the 33 participants, and you see it broken down by the Marco VAW study versus the Encampment study. The Marco VAW participants were recruited through the 46 VAW organizations in Toronto that either have a mandate for addressing violence against women or deliver a VAW service. The encampments participants were recruited by workers who are supporting encampment residents, going into 6 distinct encampments in Toronto and speaking with them, and then doing recruitment through that. Individuals in both studies participated in a survey first, and then identified if they were willing to participate in a semi-structured interview. I want to highlight some of the noticeable differences. They're going to come up when we're speaking about analysis or when we're going through the analysis. The Marco VAW participants were predominantly cis women. They were about 10 years older and they had a higher level of education than the Marco Encampments participants. Both groups were racially diverse. Both sets of participants were facing significant economic disadvantage at the time of the interview. However, what's notable was most encampments participants were receiving disability or social assistance payments, while Marco VAW participants had household incomes of less than $20,000, but many of them also held down, to a certain degree, part-time jobs. Marco VAW participants had access to multiple VAW services, so counseling, shelter, children's support, health, legal advocacy. It's not to say that the supports they were accessing were working very well during COVID, but it's simply to say they were accessing those supports, and it'll become relevant when we're speaking about the analysis. Whereas Marco Encampments participants, so participants living in encampments, tended to have higher levels of history of incarceration, problematic substance use, bless you, precarious immigration status, severe mental health and or disability. And unfortunately, even though they had more of these factors associated, they were not accessing additional services and were on immense wait lists. So that'll come up when we're speaking about analysis in terms of who our services really cater to, or whose needs our services really meet. due to time, there is a paper, a research paper published, and so it has a very lengthy methodology section. So I'm going to skip over the methodology pieces and get right into the analysis. I'm happy to answer questions related to methodology, though, when we get to the question section, if that's helpful. So there were three key themes that were generated. We generated the three themes to understand women's experiences of VAW and homelessness. So the first one was inequities were exacerbated, so abuse of power and control were seen as pathways into women's homelessness. Negotiating trade-offs between safety and autonomy was constantly a theme that came up. And then gender stereotypes, which is gender transformative approaches, where there were these scenarios that were described that I'm going to get into, which were very much based on services stereotyping women. And then there was certain responses that women described as transformative and supportive of them. The first theme identified was that COVID-19 exacerbated existing inequities related to power control between perpetrators and survivors of violence, and this often served as a pathway into homelessness. This dynamic commonly manifested through family violence from an early age or intimate partner violence. Men, typically holding greater social and economic power, exerted control over women in their lives, often through abuse, creating unsafe environments that either led to homelessness or forced survivors to remain in the abusive situation until their safety was imminently threatened. Participants' decisions to stay were often linked to systemic barriers, including a lack of available shelter space, limited access to temporary or long-term safe housing, and insufficient socioeconomic supports. So, for instance, you can see this is a VAW participant. I was getting 1,000 from Ontario Works, social assistance in Toronto, and that had to pay for everything. So anything over 800, I couldn't. And I've seen a lot of places, and they're terrible, as you can probably imagine. So I do want to say that there was a plan to go rent our neighbor's basement, and then COVID came, squashed all of that. I started calling all the time to see what was available in shelters because I wasn't sure. I'm calling every day, and the search went from Toronto to I'm talking to people everywhere in Southern Ontario, and there's nothing available, so we stay. And this was really, unfortunately, pre-COVID, during COVID, all the themes I'm talking about, you will see that they're still occurring, unfortunately. They were there pre-COVID, and I guess COVID exacerbates them, but they always existed and they still exist, unfortunately. Another example that came up for a few women was the sabotaging of housing options for by their abusers. So you'll see this participant was an encampment participant, and she goes, okay, so yeah, I was in a bad relationship. I decided to run away from the relationship, got a condo. My ex decided that he wanted to get me kicked out of the condo because he wanted me to be where he was, which was on the street. He went to the condo, beating on everything, on the floor, on every floor, and then he went and sexually, not sexually assaulted, but made vulgar comments to the lady at the front desk. And yeah, so they put us both out, but he got arrested, and yeah, I had to leave. Participants also described the person using violence was often experiencing problematic substance use themselves and having challenges with employment. And often with challenges with employment meant being unemployed. And so you see this participant saying, so the baby in the house, we're sharing the space all the time because everything was closed. I couldn't go to the mall because I had to be there because it was locked down. So it was all the time, no job, he was drinking. And you know what? He's the one of these persons that don't believe in COVID. They don't believe that it's true. It's all a lie for the governments. It's, he was like, I'm not gonna wear a mask, it's against my belief. So it was all of this stuff, we're fighting about that, right? And so this scenario that's being described, being a frequent scenario described during COVID for women, who were, I guess, locked down with their abusive partner. The second theme that emerged was negotiating trade-offs between safety and autonomy. Participants' beliefs, values, and practices related to safety and autonomy were key factors shaping their decisions about housing options and experiences of homelessness. These negotiations were often complex and constrained by limited choices. A distinct pattern emerged among the Marco VAW participants. Although they initially accessed generic shelters or non-gender specific shelters, their final destination was always a VAW shelter. And that is probably how they ended up in the study. And in no instances were the women who were in the Marco VAW participants, they would describe two of the three or one of the three, but they never described having all three. And that's experiencing problematic substance use, severe mental health, and precarious housing or homelessness. Whereas the Marco encampment participants overwhelmingly expressed all three. And unfortunately, they could only access generic or non-gender specific shelters, as they were either ineligible for or unable to secure space within VAW shelters. During the data analysis, VAW organizations were brought together to provide thoughts, comments, and feedback on analysis. And they suggested that these differences may be linked to shelter eligibility criteria and the capacity of staff in VAW shelters to address safety-related concerns associated with problematic substance use and severe mental health issues. These criteria and capacities vary across VAW shelters, without a doubt influencing who is getting access to support and who's not. One thing considered in the negotiation of safety and autonomy was a level of control about who was around them, social control, and how much of their physical movement was their decision. Participants frequently described concerns around their physical safety in the homeless shelter or generic shelters that were linked to mental health, problematic substance use, and shelters not being gender specific. Whereas in VAW shelters, it was related to restrictions such as not being able to use substances or not having access to food or being able to leave the room when they had kids. So there was something coming out in this study related to negotiating physical safety. And so here are some examples of statements from VAW survivor. We need to go to women's shelter because the emergency shelters are horrible. Like literally, I was feeling very depressed. It wasn't clean or anything. We were hearing other families. People have brought alcohol, like you would have heard people yelling. We felt very unsafe there. My kids would literally sleep right on my chest, both of them. And then you see the experience of an encampment participant. And I just want to say, I apologize in advance. I should have given a heads up that there is sensitive quotes that will come up. And if anybody is triggered, please take a moment, and I'm happy to chat afterwards as well. My boyfriend was effing beating me up on the other side of the door, an office, and they refused to come see me or help me. They said they were afraid for their own lives. They didn't want to step in, and they left me there. And this is an encampment participant referring to her experience, and they being the shelter staff. Participants also often interpreted rules as arbitrary and belittling, creating an environment of heavy surveillance that was unsettling for residents and described as dehumanizing. And so you can see an example of this from an encampments participant. They don't treat us like anything, but like we're their job, or like we're just entertainment. Like we honestly think that we're like on Big Brother. We see cameras everywhere. Like no wonder we're effing all going crazy, because these people are antagonizing us with this shit. They want us to distract from getting where we have to go, getting an apartment. Instead, we're too busy fighting staff to have a drink in our room because we're having withdrawal. We're not effing children. And then here's one from a VAW participant. My daughter and I were separated, and that was really hard because we had no say in the matter. So right away, it was not a you're safe here. And I know my daughter is freaking out, not because she's screaming, but I just know her. And I'm like, can I just go and make sure that she's okay? Then we just sat in the office. They left us alone, and we just cried for 45 minutes. They told us we could not sleep together. So this concept of shelters having these rules that felt dehumanizing, you saw them during COVID, and you still see them right now across shelters, whether it was the generic shelter or the VAW shelters. In terms of, there was an entire section, and this one was a tough one, an entire section around encampments participants explaining why, when they were negotiating safety and autonomy, the considerations they were taking into play. And I think one participant put this well. and she described it as choosing between the lesser of two evils. Both generic and homeless shelters, the generic homeless shelters and encampments are unsafe for women. Women across the board described that. But they described, based on their personal situations, having to negotiate which one of them was the safer option for them. So for instance, almost all participants in encampment study were managing problematic substance use, and due to the way shelters operate, the chances of something going wrong and no one being around was higher, whether that was a VAW shelter or a generic shelter. And so what we found and what we were seeing in the study was that if a woman was experiencing problematic substance use, she would negotiate that because she would feel safer in encampments. And you can see an example here. Honestly, as an opiate user, I think it's a lot safer to use in an encampment compared to shelter, because there's always people around to make sure you're okay. We usually try and at least sit together, or like, you'll say to somebody like, hey, just come back and check on me in 5 minutes, kind of thing. Other times, participants described physical safety reasons for not remaining in the homeless or generic shelters. And so you'll see this one comment. I have a picture, and this is from an encampment participant. I have a picture of one of the men on there. Yeah, I think he was just stalking me. I took a picture of him standing right there looking at me, and he's tried to have a couple of conversations with me in there. And then I actually said something to him, and I went out the door, and he comes out the door after me and yells, fuck off. And in short, she didn't go back. She went to an encampment after. Participants acknowledged significant safety risks, particularly for women across both homeless shelters and encampments, with several recounting experiences, unfortunately, in accounts of rape and other forms of sexual assault, both in the generic shelters and in the encampment. Despite these risks, many expressed a preference for living in encampments or rough sleeping due to the greater personal autonomy it afforded, especially in relation to protecting themselves. As one participant put it, in an encampment, you can run out there. In encampments, women often describe their sense of safety as being connected to relationships with men who opposed violence against women and who were willing to intervene if harm occurred. So residents established their own rules and consequences for violations, which they described as often being enforced through intimidation or physical retaliation against those who committed violence. And so I think the encampment participant at the bottom kind of summarizes what I was saying. I've heard it like, it's not even like it's not safe for people really to be here, especially like females to be here. Here, like, I know most of the guys around here, so this is pretty okay. So if I wasn't right here knowing these guys, if I wasn't in this situation, then I probably wouldn't say it was a safer experience. Women also reported keeping weapons or pepper spray for self-defense in encampments. These are items that are prohibited in shelters. In contrast, participants described homeless shelters as environments where women were often vulnerable to violence, with little ability to seek help or escape unsafe situations. They would be cornered and have nowhere to go. Additionally, participants described experiences of criminalization related to substance use when accessing formal services, and expressed that they couldn't rely on police for protection if something happened to them in a shelter and they called for help. So the other, sorry about that. The other consideration that participants expressed when negotiating safety and autonomy was around the feeling that their human dignity was being enhanced. When women preferred shelters, it usually involved considerations around enhancing human dignity, and the case of this study was always, in the case of this study, those instances were always related to a VAW shelter or a gender-specific shelter. For instance, one encampment participant described splitting her time between a women's homeless shelter and an encampment to draw on benefits of each, explaining, I'm half in the encampment and half in women's rest, just because it's easier to stay clean when you have access to, their washers, their showers. I can wash my clothes easier, and I don't have to be in a women's rest until 3:30. So it was like, a gift. It was hard to give up the whole shelter thing, but the food is way better in encampment, I can say, and it gave me the opportunity to realize that humanity really does care about each other. On the other side, you see a VAW participant. They were feeling like home. That shelter was not like prison. You can go in the kitchen, the cooks are good, they behaved good with you. I'm not scared when we sleep. So food, food and the type and quality for both encampment, the type of it and the quality for both encampment and VAW participants was also often tied to them feeling that they were receiving human dignity, along with access to clean, safe showers and washrooms. So the gender stereotypes or gender transformative approaches was the third theme. The social construction of gender played a central role in the services participants accessed, both in terms of the supports that were available to them and what they felt they could or deserved to access, and how well services met their needs. Several participants emphasized why they were or were not deserving of the support that they had needed or received since becoming homeless. In this context, service providers, homeless or VAW, seem to be putting forward thinking that supported the thought that something needed to be earned and that there were certain characteristics that made some women more deserving of support than others. And our analysis landed on there was something or a way service providers, whether VAW or homeless, were communicating to women that was making it so women were taking on this mentality of either being deserving or undeserving. You'll see the first one is from an encampments participant. Well, they basically told me, they didn't want me to stay there because this is for women who are trying to change their lives and, trying to make it structured and to be out looking for a job and, to be out doing something with yourself. And that's not looking for drugs and then sleeping all the next day. Or you see the comment from the VAW participant. The staff saw something different in me. I'll be honest, I think I got some preferential treatment. They knew that I was educated. They knew that I was going to church on a weekly basis. They knew I was apartment hunting. If I had nothing to do, I was going to the library to go on the computer and try and find something to do. All the resources that they offered, I was just taking it. And so, they really liked me. And so these quotes really showing how service providers respond to women can really impact how women view themselves and the supports and safety that they deserve. Another key area that came out under this theme was the intersection of motherhood. Was the intersection of motherhood. Most VAW participants had their dependent children living with them, whereas only 3 women in encampments wanted to speak about their children. That would be primarily because many of the women in encampments didn't have their children with them, even if they did have children. One of the encampments participants that was willing to speak about her children described having an adult child that she doesn't have contact with, and the other 2 women that volunteered to speak about their children weren't in their custody. So the topic of children for encampment participants was a very difficult one, and most encampment participants identifying that and saying they preferred not to talk about it. For VAW participants with children, shelter experiences often revolved around their sense of agency for caring for their children and the adequacy of supports to meet their children's needs. So, one VAW participant says the VAW shelter was really good. It was supportive. They provided interpretation services and also my kids' food and clothing. There were children's counselors in the shelter, and then I could discuss about my children's behavior, and then they helped me a lot. And then the other VAW participants describing the tour and intake process took about an hour and a half. My daughter and I were separated, and that was really hard. We had to say no. We had to no say in the matter. So right away it was, you're safe here. And I think we talked about this one. This participant, she frequently described, and I think there were 3 other participants in VAW shelters that frequently described how the COVID mandates were traumatizing to their children and to being a mother. And it's to note that although the separation and the rules around the mandates were specific to COVID, there are still these pieces that occur in shelter related to mothers and children. And in terms of telling mothers about how to raise their children, stigmatizing mothers in terms of how well they are as mothers. So it's just to say, VAW, if it's on a spectrum, VAW services are more trauma-informed, but they still have work to do. So I just didn't want to glaze over to make it seem like the VAW services in comparison to the homeless shelters don't have work to do. Definitely have work to do related to eligibility criteria, becoming more trauma-informed. But I guess I kind of see it on this trauma-informed spectrum, and so where's the dial kind of thing. Positive experiences, and so this is the last piece there, that positive experiences identified were often linked to gender-specific programs or VAW programs. And so you're going to see the quotes there that say, I think seriously, and this is from an encampment participant, I think seriously looking and being so intentional in training people for those roles within the VAW and violence against gender-based violence is so critically important because, you know, you have so many women, unfortunately, and female-identified individuals that are going through so much pain, and they just need something or some kind of compassion or empathy, and to know there's a different way. We need more places for just women. And then you see a VAW participant say, they talk to you like a human. We make jokes, we laugh. If they have anything funny to share, they like to talk to us. They didn't make you feel broken, and that was the best part. Like, I have one of the staff who was amazingly great with me, and she used to work with disability kids. And like, I'm having a hard time with the girls. I will cry to her, and I'm like, I can't do this right now. Like, they're having a huge meltdown, and she'll teach me some of the ways to deal. I have so much love for them who helped me grow as a single mother of 2 disability children, because that I felt like at the beginning and never could have done it myself. So I think what we were seeing come out in the study across the board, whether it was encampments or VAW survivors, was that there was a need for survivors of violence who were identified as women, cis women, trans women, or gender diverse, to be able to access spaces that were specific for them so that they could heal and change their views and values of themselves. I think in this section where they were talking about transformative approaches, the thing that really stood out to us is when a woman was accessing a service that they see that was gender specific, that they felt as transformative, what came out was that they changed how they saw themselves. They changed how they viewed their capacity to heal, how deserving they felt that they were. And then they were more likely to attach to other services to rebuild their lives. In contrast, unfortunately, the encampment residents were not having that experience. And that's because our systems and services were not set up to support they're not set up or are not doing it. They're not addressing problematic substance use, severe mental health, and homelessness or precarious housing. And so individuals or women in this study who were experiencing all 3 of these things, their chances of getting support were just so minimal. There just weren't services that would support them. And if there were services that could support them, I mean, you saw the experiences that they were describing. They were just as unsafe. And so I guess I pushed that point home because in the news in Toronto, and I'm sure this is all over our country, there's this push to clear encampments. And the reality is, clear encampments, and where do they go? So I guess I want to say, from an advocacy and action standpoint, clearing encampments can't be the solution. We can't clear encampments unless we're giving people an alternative. We can't clear encampments to let them go into these experiences that we've just described. Some recommendations. Our results highlight the need for strengthened intersectoral coordination between VAW and homeless sectors and a unified policy strategy to address homelessness that applies a gender transformative and intersectional approach. This should include adopting standardized inclusive definitions of homelessness that accounts for women's hidden homelessness to inform homelessness policy and pragmatic targets. It should be aimed at eligibility criteria and funding. So in Toronto, for instance, the homelessness sector and the VAW sector very much operate in silo. They have separate programming. The funding doesn't necessarily overlap. And I think that severely impacted the experience of almost every participant in the study. Sustainable investments should be made to enhance capacity, staffing program, and training across the VAW and homelessness systems to deliver gender-specific trauma-informed services. And this includes incorporating harm reduction approaches, and that should happen across the board. We should be considering from a trauma-informed approach how we can make environments safer. So part of our recommendations when we're working with the city now is, yes, the municipality, you may run certain shelters that are not gender specific, but why can't you create the inside of the shelter and the environment as separate? There's nothing stopping you from reorganizing how the building is structured and separating into two different spaces. Where am I? Okay. So I'm going to quickly go through it because my time's up. Provide parenting and child support for women. I think that one's obvious. And we're saying there needs to be some resources putting into funding emergency preparedness in VAW and homelessness systems, especially after COVID. What's insane is that COVID happened. There was the talks of funding that, and then it didn't happen. And so we really should learn from this experience and be a little more proactive. And then this is the obvious one that we will hear from every presentation, and that's expand safe, affordable housing with wraparound VAW supports. So all safe, affordable housing for individuals that are further marginalized should come with wraparound supports. And we don't have time for we're going to do some questions at the end. So leave this up for 5 seconds. I would love, when it's question and discussion period, please feel free to ask me questions, but also Women Act as advocacy on the ground, and encampments is a very prominent thing in Toronto right now. I'd love to hear some of your thoughts on advocacy or programs and pilots that are working well in your region. And I know my next presenter is going to give me some of those too. So I'll wrap up. Thank you so much, everybody.
Okay. This is the last one of the day, I think. Presentation. I'll try to be as exciting as possible up here to keep everyone awake. I don't know if anyone else watched to the bitter end of the Jays last night, but I did. So I'm feeling a little sleepy, but I'll try to get through this. So my name's Chelsea Kirkby, and I'm the Vice President of Strategic Initiatives and Program Development at YWCA Hamilton. I use pronouns she, her. And I'm going to walk us through, I feel like we're a bit of a call and response here with Priya, so thanks for setting the stage with your presentation in terms of the experiences of women and gender diverse folks living in encampment. What I'm going to go through is how we've created a gender responsive program to support those individuals. So through this presentation, we'll consider the gendered consequences and safety concerns of encampments for women and gender diverse people. Much more succinct. I think you did a really great presentation to share all the details. We'll learn about a replicable program service delivery model that really focuses on gender response to serving women and gender diverse people who live in encampments. So I'm just going to figure out how to scroll down here 1 second. How does that work? How did you do the scrolling down? Did you just use the... Oh, okay, that's fine. Thank you. Okay, and then we're also going to reflect on the lived experiences and perspectives about the unique gendered consequences and safety concerns. Now, okay, so just a bit of history around the encampments and particularly the impact on women. In 2023, the Federal Housing Advocate, Marie-Josée Hull, released an interim report on human rights within encampments or issues within encampments across the country. And this report really highlighted the gendered experiences in encampment, showing that many women and gender diverse people who are living in these encampments are there because of a lack of gender-specific housing services and because of a mistrust or mistreatment within those existing services. The report also highlighted the health, social and safety consequences and risks for women and gender diverse people living in encampments. Next slide. Is it going? There we go. Just making sure. Yeah, okay. So YWCA Hamilton operates a multi-service building in Hamilton's downtown core. So in that building, we house over 100 women in emergency accommodations within this building. And just to provide some context as to kind of the breadth of that building and the scope of the work that's done there, we have a 24/7 shelter, 20 beds with that program, a 65-bed transitional living program. We have a drop-in overnight shelter that can bring in 25 to 40 individuals a night. We have childcare, we have a safer use space, justice services, immigration and settlement programming, developmental services. We have, I already said childcare. Anyway, a range of programs all operating out of one building. And the housing programs have really expanded and grown over the last few years to respond to the need in the community. And outside of our building, we see a lot of unhoused individuals right within the vicinity of that building. And we respond to the needs of gender diverse people and women that are right outside of our building through different programs I'm about to review with you. For some additional context in Hamilton as well, Priya, you mentioned, what we're doing, that we're trying to remove encampments kind of across, I think, all cities and all spaces that we're probably working within. In Hamilton specifically, we did have an encampment protocol in place until this past spring, so that allowed individuals to set up their camps in parks without having the risk of being moved in response to having an insufficient or not enough available shelter space. So the municipality did increase shelter space significantly in the springtime. So we have more spaces available indoors. However, it still is not meeting the need of unhoused individuals in terms of number of spaces, particularly for women. And so with the protocol, so they stopped the encampment protocol, which means that now individuals are being told, you can't be here and you can't be there. So you really can't be anywhere. And so it's really, really difficult for everyone involved, especially those that are supporting these individuals and those who are experiencing it. And then we're finding that this situation is particularly difficult for women for all the reasons that Priya shared earlier. Women are facing violence when they're living in the streets or living in encampments. There's an increasingly toxic drug supply. We're seeing an increase in drug poisoning in our community. So we're dealing with, a multitude of crises, homelessness, gender-based violence, and the drug crisis. Just trying to get my next slide here. I don't know why. Oh, it's because I have to use the mouse. Okay.
Here.
There we go. I don't know why it's like
It's finicky.
Yeah. Okay, so I won't go into too much detail around the gender risk encampments. We just had a fulsome presentation on that. But our experience in Hamilton is that our teams are responding to multiple instances of gender-based violence occurring in encampments throughout the work that they're doing. And that includes intimate partner violence, so that relational violence, as well as random gender-based violence as well, and sexual assault. We're seeing a lot of gender-based exploitation, so women and gender diverse people who are living in encampments are impacted, disproportionately by risks that are related to human trafficking and exploitation, and barriers to accessing prenatal and postpartum care as well. So there's limited shelter space for couples or insufficient space that supports individuals through the pregnancy and postpartum. So many women do choose to stay outdoors or are forced to stay outdoors with their partners during the pregnancy due to a lack of accommodation indoors. So over the last few years, we've been trying to integrate our service delivery to respond to the complexity of needs to those that we're serving. So when supporting those living in encampments or on the street, we use this gender-informed or gender-responsive approach to inform our services. And so we've combined our gender-specific harm reduction kind of mobile response with an outreach team specific to women and gender diverse people that are frequenting the area near our shelter but aren't accessing it, as well as reproductive care, emergency reproductive care outreach as well. So we have a number of these different programs kind of operating, and we've brought them together to operate together. And the goal of this work is really to reduce the harms and improve well-being for women and gender diverse people who are experiencing homelessness and living in encampments. Okay, so what are we at now? Yeah, harm reduction. So I'm just going to go really briefly over the three different kind of program areas and some of the impact we're having, just to give a sense of the scope of the issue. This is just one city, one program within one organization, just to see how we're operating and what kind of an impact we're able to have with this model. So the gender-specific mobile harm reduction outreach team responds to urgent basic health and safety needs of women and gender diverse people who use drugs, so including overdose response, wound care, infectious disease prevention and treatment. And they do this by distributing harm reduction supplies, distributing naloxone and training folks on how to use it, ensuring the safe disposal of used supplies, and safety planning with people who are using substances to limit harm and risks associated with drug use. And I did mention that we do have a safer drug use space as well within our buildings, so we're able to make connections into that space as well. And some of the impacts and outcomes of that program. So since beginning this program in April 2025, so it's fairly recent, we've supported 250 unique women and gender diverse people through this mobile approach. And we've responded to over 30 overdoses or drug poisonings that are happening right outside our doors with 0 deaths. So before that, we didn't have people on the ground outdoors who were able to respond quickly for those who aren't using indoors. And we've made over 250 referrals to low barrier substance use or addiction services, as well as we have an on-site addictions counselor and a health clinic to help support individuals. And we've distributed hundreds of naloxone kits to the community and safely disposed of thousands of pieces of harm reduction equipment. So another unique program that is integrated within our response is reproductive care and gender health equity outreach. So we respond to urgent health and safety needs of pregnant women and people who are living without housing through wraparound supports, referrals to service, and really by meeting people where they're at in a very non-judgmental, supportive way. So we provide dedicated outreach in encampments to women and pregnant people who are experiencing any health concerns or who are seeking support. And we connect these individuals as well to transitional beds within our larger transitional living program. So we have 3 beds that are dedicated to individuals who are pregnant or postpartum. And we really, through this program, we provide low barrier pregnancy testing, STI, STBBI testing, referrals to prenatal care providers, and pathways into a program through our hospital for pregnant individuals who are using substances. So some of the impacts and outcomes of that program. So this program began in August of 2022, and from that point until now, we've had over 145 referrals to the reproductive care outreach team. So that's for women and gender diverse folks who are pregnant and experiencing homelessness in Hamilton. And of those 145 referrals, 71 were referred without having any prenatal care up to the point of referral, and typically we connect with them fairly late into their pregnancy. And a few other impacts. Over 101 reproductive health care plans and birth plans were made with these individuals. There was over 130 accompaniments to medical appointments, so really walking alongside individuals to help them access the care that they needed. 53 of these pregnant folks access mental health supports. 13 of these people ended up in our emergency reproductive care beds. They were able to access those transitional living beds. And 100% of these pregnant people delivered in hospital and were connected to a prenatal care provider at the time of delivery. And this is one of our, we always struggle to measure the impact of this program and what difference this is making. But to have these individuals, be able to make it to hospital and deliver in that space has been one of the successes, because we do have a number of incidents of delivery within the encampments as well. And in terms of just our more broad gender-specific outreach team that has a gender-based violence lens to it. So this team provides outreach support to women and gender diverse people outside of our organization, or also outside of our buildings, those who aren't accessing services indoors and who aren't being supported through emergency shelter. And this program engages women and gender diverse people who are living in other unsafe temporary accommodations and connects them with service navigation, referrals, and supports. It also provides access to basic health and safety needs, such as weather-related support, food, nutrition, and low-barrier access to healthcare. So we do have healthcare services that are offered within our organization as well through a partner organization called the Shelter Health Network. And we also engage in gender-based violence risk assessment, safety planning, and service navigation for those who are at risk of experiencing violence in the community. There we go. So some impacts and outcomes of this program during the summer months. So just this past June, July, August, the outreach workers supported an average of 200 unique clients a month. And this is women and gender diverse people without housing, so we're not serving the male population at this point. Distributing an average of 250 weather-related support items to cope with the extreme heat. So this could be sunscreen, hydration, nutrition, loose clothing, hats, that type of thing. And we've been providing an average of 50 referrals per month to healthcare-related supports and engage 20 women and gender diverse people per month in safety planning as well, so relate to that gender-based violence in the community. So that was just a quick overview of kind of the programs that we're offering, some of the impacts that we're seeing through that programming to try to meet the needs that we're seeing, the complexity of needs. We also refer individuals to the various other programs and housing supports that we have to offer, but these programs really focus in on being able to get out into community, to encampments, to those who are experiencing street-level homelessness. But I also want to talk a bit about our gender-based safety audit that we conducted over the last year. This is about how we engaged with those with lived experience to help inform our program models and to share kind of what's most pressing, the most pressing needs in the community. So gender-based safety audits that focus on the safety needs and concerns of women and children have been around for decades. The Metropolitan Toronto Action Committee on Violence Against Women and Children, so METRAC, is a well-known leader in conducting safety audits and started conducting these audits over 40 years ago. And audits invite community members to name a few of the factors that lead to feelings of being unsafe and invite suggestions on how to make places safer. And a gender-based safety audit is a process that invites community members to identify safe and unsafe physical spaces in the city and recommends how the unsafe spaces can be improved. So some of the feedback was through literally like walking through neighborhoods or walking through spaces to identify different needs and how people are experiencing it. And input is gathered from people who live, work, or play and visit Hamilton. And since this was a gender-based safety audit, we are particularly focused on gathering the wisdom and experience of women, children, and gender diverse people. And by addressing the unique safety risks faced by women and gender diverse people, we engage the safety, dignity, comfort, and accessibility needs of many Hamiltonians. So throughout the spring and summer of 2024, last year, women and gender diverse people who are experiencing homelessness and accessing a range of drop-in spaces or harm reduction supports or some of our outreach services were invited to create art pieces responding to the following prompts. So how do you define safety and talking about individual and community safety? What is safe and unsafe in your community, your relationships for you? What are the physical spaces in your community that make you feel safe? And what are the spaces and places that make you feel unsafe? And what would you put in place to make your community safer? What do you imagine would help you feel safer? So I'll just go over a few of our responses, much like Priya did in her presentation. We want to hear from people. So I'll just flip through a few of these so you can see what kind of experiences were shared. I'll just look up there. So this one here says, I drew a spider web to represent a web of safety. Oh, is it making the sound? A web of safety around me. The web represent, now too much, this way. Okay. Stand back a bit. Okay. The web represents all the services offered to the homeless and needy population. The web is what makes me feel safe. This one here says, every few blocks there should be a phone for women to call for help. A lot of women who are homeless don't have phones, and all the pay phones are gone. We need to start making more housing for homeless people. I won't go through this whole quote, but it does say, on the streets, especially at night, have been the most scary and fearing times for me. At times I've been homeless. There have been many streets specifically that I don't dare to be on once the moon comes out. I was once staying on the rail trail in a tent a few years ago at night, and I'd be freaking out thinking there were noises all around me. Turns out there was someone standing and watching my tent. When you're homeless, you're more likely to be a victim of random public violence. Abandoned parking lots, laneways, and alleyways are all scary and dangerous. We need spaces open late. The Hamilton Public Library is one of the places in the city where I can go and feel safe. The library gave me a quiet space where I can just relax and focus on my dreams and goals. It provides me a safe place to just be alone and work quietly. Hamilton Public Library is such a blessing to have, and for that I am forever grateful. Thanks. Things that we need more that are sometimes missing in Hamilton: access to more places that are warm when it's cold out. The houses in my drawings are some of the warm places. Safe places with nature are good too. Those trees in my drawing are safe places. So through the safety audit, the gender-based safety audit, a number of recommendations were put forward based on the experience of individuals and what they shared with us and what they hoped to see. And so some of these recommendations were that increase in access to telephones. So women, gender diverse people who are living outside can call for help if they need it. To increase the web of gender-specific support services available to women and gender diverse people who are living in encampments. Ensure that there are places and programs opened at night for people living outdoors to access, and recognize and respond to women and gender diverse people's safety concerns relating to violence on the streets. And then just to wrap up, I just want to share some of our next steps on long-term vision. And these really take into consideration the experiences that were shared by the individuals in the safety audit, as well as the experiences and what's shared through individuals that are accessing our programs across our spectrum of housing and outreach programming. So we're in the process of developing a new supportive transitional housing project called Oakwood Place. So this is a new program that will offer 90 units to women and gender diverse people who are experiencing homelessness in Hamilton. Within that space, we plan to integrate childcare and health services as well. And that will have space for families as well as for individuals. We want to enhance a gendered lens on encampment response teams through fostering stronger partnerships between existing teams and our outreach programs. I don't know about other municipalities, but Hamilton has, I think we've counted upwards of 19 to 20 outreach kind of teams throughout the city. And they all bring kind of different expertise or different types of programming. So we have done certain things with those larger outreach kind of networking, community of practice meetings, talking about reproductive care, how to work with someone who's pregnant, and bringing that gendered lens to the larger group so that anyone who's encountering a woman, someone who is gender diverse or who's pregnant can bring the right approach, or an approach that might be supportive. And then we want to continue to advocate for additional funding to increase hours and capacity within our drop-in program. So that's very specific to our location, but it's not a program that operates 24/7, so to be able to allow folks more time indoors is really important, but always dependent on different funding. And then we've also just recently opened a new safety and support hub. So this hub provides system navigation and supports for individuals who are experiencing violence and their families. And so this is a brand new hub model where multiple organizations are working together in partnership out of one space, so people can walk in or self-refer and access all the supports that they might need or be connected to what they need. So we want to ensure that that space is one that is open and available for those who are living in encampments or who are experiencing homelessness as well. So those are just some of the next steps and kind of what's on the horizon for the work that we're doing. So that's all. I just wanted to share some of the work we're doing. I think it was good to have you present first so that we can then see what's happening on the ground. So yeah, thanks everyone. If there's any questions, we're I lost my voice cheering last night.
Thank you. Hello. We'd like to take questions.
I get it, everyone's hungry.
I know, everyone's done.
Everyone's tired.
There's a question.
Hi, my name's Sharon. I'm from Pickering area in Ontario. Just a quick question. It's one of the things I've been running into quite recently is getting around that the issue of you have someone that's unhoused. They are people that are or women that are being abused by their partners who are also living with them in the community, and I kind of have to lie, lack of a better word, to get them into the proper shelters that they require. Because if they say that they're not housed, that's a hard no. So, and the sad thing is, one example, there's a young woman, she's like 28, and whenever she would be abused by her partner, he would actually stalk her on the GO train and watch her. He'd break in and watch her on cameras. So all the places she needs to go for showers, food, all those things, he's there. And there's absolutely no escape, and it's a fairly small community. Just wondering, kind of what people have done to get people in. I have managed to sneak people in with a lot of coaching. They have to make sure they don't say the wrong thing, like I'm homeless and I'm leaving my tent. Otherwise, they're shut down. Just something I've been dealing with this last winter that I'm sure I'll deal with again at my warming center. I've managed to sneak 3 women out of this church with their partners in the building to get them to a shelter. But that's with a lot of coaching so that they don't say the wrong words. Thank you for listening.
Thank you for the work you do, and thank you for sharing that. And I wish I had. I was a frontline worker for a very long time, and I wish that the stories that we've heard from workers in the study said something different. The honest answer right now to your question is it is what you're doing. You make that phone call, you prep the woman who's going to make the call to get around those eligibility criteria until our advocacy changes them, unfortunately. I will open this one, Christy, or to the floor if somebody has an alternative answer. At the moment, though, I think what you're doing is the advocacy piece, and the rest of us at this that are doing the system level advocacy are going to work very hard to catch up to it so that you don't have to do that.
Yeah, I don't have an answer for you. I think it does speak to the kind of siloed nature of the work and what we see as who is eligible for whatever type of housing or shelter. Yeah, where we operate one second stage VAW shelter, but for the most part, we're very, low barrier shelter, like come in with what you need, but it may not be the appropriate for certain individuals as well, right? Like it's all looking at the right fit and where folks will be most successful. Well, with looking at, shelters that are completely full and they're turned away and we actually can't fit everyone in. So, yeah, I don't have an answer for you either except to continue to advocate. We've had a bit of a shift in Hamilton specifically around, we have a temporary shelter expansion funding right now. So we have a number of temporary shelters, emergency shelters that have opened up, not specific to the VAW sector, but it was inclusive of VAW sector this time. So there's a number of beds that were opened up, I think it's 10 or 20, that are more flexible, I'd say. So that's, I mean, just an experience from this emergency type funding that comes up, but it's not a system-wide solution.
And I'd agree with that. I think under the study, one of the things we saw was eligibility criteria would all of a sudden become more flexible the more emergency funding available. So when shelters were able to take on hotel spaces, they were more likely to have clients or take on clients that they wouldn't necessarily, had they not had the emergency funding and emergency space, necessarily said yes to. So there is something there associated with equipping people with resources, more space to respond.
Thank you. I'm from South Shore of Montreal. And I was wondering, well, first of all, thank you very much for your presentation. It was they were very interesting. I was wondering, what's the position of Hamilton and encampments? Like, do they allow displacement or not? So that was my first question. And then it seems like you really developed in Hamilton like an expertise in gender, like women, like assisting women who experience homelessness. And like, has that been a long time? Like in Hamilton, how did you go? How did you get there? And do you have I'm looking for my words.
Tu veux parler français aussi?
Ok.
Oui, ma réponse va pas vraiment en français.
Oui, c'est ça. Est-ce que vous avez des recommandations, en fait, là, pour aider les autres villes, justement, à avoir des programmes qui sont spécifiquement pour les femmes?
Yeah. Okay, so to start, so the YWCA, I would say, is one of the women's organizations, a few in Hamilton, but ours is the one that works within housing homelessness. Has been developing these services, I guess, over the last few years, but always looking at the system and saying, okay, where is there a gap? Where are we seeing needs related to women and gender diverse folks? And I think in this room is probably individuals who are interested in this topic, but not everyone is. And so literally every table, every meeting that we're at, we're the voice that's saying, what about women, what about gender diverse folks? Here's the different specific needs, or here's like their situation. Here's what we need to do differently. And so it's just, a lot of advocacy and pushing for things that to look differently, and stepping in when we don't see an adequate response. And, separate from what I'd say, some of the really specific examples of it is the emergency reproductive care piece. So there was no supports available for pregnant people in encampments. And I think, what was my stat, 145 people since we started the program that are pregnant in encampments. That's a huge number of people, right? So we built this program out. We were able to, bring different funding in to help support it. It's normally very precarious, the work that we're doing in terms of funding and supporting these projects, but what we try to do is create the program, show that it's working, and then create more sustainable, or be able to kind of advocate for more sustainable funding to keep it going. So the reproductive care program, we're in kind of, our foot is in two pieces of that. We have some sustainable funding to keep it operating, and then we have some precarious funding for enhancements, and then we just hope to continue it. Our safer use site is the same. We knew that the experience of women in mixed gender, open gender, what you want to call it, safe use site, was not great. They were experiencing violence. They were being victimized within those spaces, and so we created this separate one. So just seeing where those needs are. I forget your other question. And then how do we say?
If you have any recommendations, I think you talked about that, and then the position of Hamilton.
Yes, the encampments. So in terms of encampment, the position. So I think I mentioned at the start, we had an encampment protocol in place. And so that would allow individuals to set up a tent or remain in the parks without being moved. And it was specific, it wasn't all over the place, but it was in certain areas. And that was reliant on dependent on the shelter space availability. So once they increased, the city provided funding, this emergency shelter funding to expand services, they voted for the encampment protocol to end, and for us to clear out the parks and not have encampments in parks anymore. So that's the position we're in right now, is that they're not allowed in public spaces. And with the assumption that there's enough shelter space there, but as I mentioned, there's not enough shelter space. So we're seeing folks either, right on the sidewalks, particularly around our building, we have a lot of folks on the sidewalks, or they're going into hiding, right? So we have, Hamilton's got a unique geographic area. We have like an escarpment, so there's a lot of like woods right up against our city, and people are going into there and trying to, hide from what's happening. And so, but that gets cleared as well. So we're in a clearing, and everyone's struggling with it in terms of, and you mentioned the same thing, I forget what your quote was exactly, but you can't exist outdoors and there's nowhere for you indoors. So people, that we're just telling them they can't exist anywhere, which is really hard. No problem.
I like that you're at least creating spaces, though.
Hi, thank you so much. My name is Cassandra. I work with the region of Peel. And my question is just in relation to the residents that are outside of your space. I imagine you're probably getting inquiries, potential complaints. How are you dealing with that? And what is your relationship like with counselors? As I'm sure in the region of Peel, we have a number of similar experiences, so I'm just curious how you've been dealing with that.
Yeah, I'd say that we are, as a community, trying to deal with it. We are, we're often seen as the target or the issue. And, our position is we're supporting individuals the best we can, and we've created additional supports like outreach, these other things to help support individuals. We do receive a number of complaints, a lot of complaints around what's happening in our space, and we do, we just often share all the things that we're doing, how we're collaborating with city, police, others around like responding to the issue. It is really sensitive and difficult. We have a good relationship with our counselors. We have some counselors that are very supportive of the work that we're doing, and we try to, connect with them, and they're also thinking of solutions and trying to see how they might support us. And the bottom line, I think we all know, is that there's just nowhere for people to go. So there's no housing available for folks. And so we come up with all these ideas and these ways of supporting people and trying to connect them to what they need. But the bottom line is that they're still without housing, and that's really difficult. So we can do as much as we can to wrap around people, but until we have enough space, we're in a really tough spot. So, but yeah, lots of, the optics of it is a really tricky thing to navigate as a community organization that's supporting people, and also people don't like the way it looks. So
Does enforcement remove the people in front of the building?
Enforcement does remove people sometimes. We have a really hard time with that too. Like I mentioned, we operate a childcare center, right? So we're like, right here's not okay. Maybe over here, where folks can be and where they can't be. But we have one of the big issues is sidewalks being completely blocked, so people actually can't even get in and out of space. So again, it's really, I think you come at it with a lot of compassion and knowing that there's nowhere for people to go, and then also trying to understand that sometimes this particular location is really not appropriate or ideal for folks to gather. So yeah, it's really hard.
Hello and thank you. In developing an encampment response and collaborating with VAW supports and services, obviously I see the best kind of support and way to do that would be like on site at the encampment. Say there is an existing gap of VAW supports not being able to attend an encampment, or we're waiting for that to happen per se. Other than just saying like, hey, how about we meet in a public space? What kind of suggestions or strategies might you suggest to keep that same level of access to VAW supports and warm transfer to those services to ensure that happens, such as like bringing somebody to an encampment with consent?
Yeah, I can go first in terms of We offer, like, our specific programming, we offer gender-based violence supports as well as housing supports and shelter and outreach and, wraparound health, like, multiple supports. And we really try to embed our gender-based violence kind of supports or approach across whatever we're offering, all that we're offering, so that our staff are using a similar approach and are able to, if it's an outreach worker or a harm reduction worker, for instance, that's out in community connecting with someone, they're equipped to at least begin a conversation or build a relationship trust to have the supports that are needed. So yeah, I think that's kind of how we've approached it, is trying to embed within our programming this lens that to recognize and acknowledge that also that intimate partner violence or gender-based violence may look different in an encampment or be experienced differently or may not be reported in the same way or not reported at all, or there's, it's very, we all know there's a lot of complicated ways of experiencing it. And I think that, so we try to embed it within and not necessarily bringing like that specific, like a gender-based violence outreach worker doesn't go into encampment, but our outreach workers have that lens, and then they can connect in with our gender-based violence counselors if needed, but we would, support anyone that needed it.
During COVID, the emergency funding supported frontline workers from VAW organizations to go into encampments with the city workers. And what it did was create pathways. So there might have not been space or a bed, but I think you might have seen one of the participants describing access to safe shelters, maybe access to dropping into the VAW shelter, and we found that made a difference. However, from what I understand, that service was being delivered through emergency funding, and there's no longer that emergency funding. The other piece there was, I guess one of the things that we're seeing is, what we're calling it is survivors who are in VAW shelters who would have previously or know women living in encampments. They all tend to know each other. I can't remember which VAW organization did it. They were training up women so that how do you talk about violence? How do you talk about the supports that are available? And we saw that it was almost like a peer-led kind of initiative, and we saw that having success with building knowledge around potential available supports for women in encampments. One of the challenging things with women who are staying in encampments is just because you show up there doesn't mean they will talk to you. They have lots of reasons not to talk to workers, lots of reasons not to talk to VAW workers. VAW workers, for example, if they know of harm from children or perceptions of you're in too much danger, you shouldn't be here, or if a story around sexual violence is divulged to them, can sometimes seek out support on behalf of a survivor even without consent. So we found that there was success in that peer-led model, where you're finding women who had the experience previously, are a little further along, and then you're training them up to actually go into the encampments. But that's with support of, it's not police, I can't remember what they are in Toronto, but outreach workers from the city that are trained for safety. So those were two that I can think of, yeah.
Maybe this is a bit out of the context, but I was curious if in your research you had any elements of safety that came up mostly for women intervention workers, the frontline workers in encampments, and if yes, do they have any specific safety strategies that they came up with?
So,
Go ahead, I can answer after you.
So, in this study created a wealth of information. We did not speak specifically to the data that spoke to that. It's a community-based research project, and so community organizations, entities, and folks had a say in kind of what the focus was. Remember, this study was conducted during COVID, so it really adds a different layer to community safety for frontline workers because it was occurring in 2020. And so there was a lot there around workers or frontline workers feeling like their safety wasn't being considered. There was a lot of issues around police, the overwhelming amount of police presence and integration. So I think overall from the study, although there was a lot of data around it, I would say a lot of the safety pieces being brought up were impacted by the time the study was being done. They were very much associated with COVID. So their health was what they were describing. There are, for the most part though, I think about a lot of the data, the safety pieces are very much related to COVID and frontline workers feeling like their safety wasn't being considered. But there were instances there around frontline workers basically speaking to safety issues related, and they didn't unpick it, related to speaking with women who may have been sex workers. And so it wasn't unpicked, but there was a lot of that data, and again, could have very much been related to the time in COVID. There were safety concerns there, but it's hard for me to unpick whether they still exist right now, or those safety concerns are very COVID specific. I don't know if there are people who go, who have been working in encampments after COVID. If any of what I said there resonates beyond COVID, I'm not sure.
I'd say with our workers, there's always concerns around safety, and then so we have policies or like procedures in place to help support that safety. There's an inherent risk to be an outreach worker, and so we want people to be in pairs, to know where folks are, to hold their boundaries, to engage, enter a situation that looks like it's safe enough to enter. You can't always predict, but not enter something that is looking like it's more of a risk. So all those things in place. But I would say something that's really interesting. We have a unique situation with our downtown location because of the number of individuals that congregate in the area and that are around, and the feelings and perceptions of unsafety as well of a lot of our staff that are coming in to work because of what, depending on the day, what they have to kind of encounter as they enter the building even. So, I can't even name an incident, knock on wood, oh gosh, of something happening right outside to our staff, but certainly physically, certainly a lot of yelling and that type of thing. But there are lots of instances of violence and activity that's harmful that's happening that's reported all the time. So we know it's happening, but yeah. So it's just creating. Like I mentioned, we're trying to create enough space so that folks can come in and out in a way that feels more safe. Is that it? Any more questions?
Questions?
Well, thank you for sticking it out for the
Thank
whole
you so much.
afternoon.
Thank you, speakers. Thank you, participants.